Okay, welcome everybody. We are good to go. And let's just get started here. Welcome everybody. We are good to go. It is great to have you here. Thank you for spending the time with me and with us in the AAFE. And I am going to just do a quick check. Tell me that you can hear me. Tell me that you can see me. Tell me who you are, where you're from, and what kind of a dentist you are. And this is geared for dentists, this program. So go ahead and put it in the chat, and this way we can see who is here. And I'm going to try to make it so everybody can see the chat, and that should work pretty well. Welcome, Allison. Tell me you can hear me. Tell me you can see me. And then in a minute, I'm going to put up my slides. And welcome, Nurmine. I hope I'm saying it right. Allie, welcome to you. Dr. Sanders, welcome to you from Star, Idaho. That's a great name. Kaylin and Rebecca, who's an orthodontist, and that's perfect for this. You're going to see this is going to be open to literally every kind of dental professional for that. Now they're coming in a little too fast. And dental hygienists. Let's not forget the dental hygienists there. So I'm not going to get to all of you. Daniela, GP, Ortho, Karen, and you can all see the names. You can see where they're from. So welcome to all of you. Keep putting it in. I'm glad you can hear me and see me. I'm going to put up my slides so that you can see them. And I'm going to want to know from you if you can see my slides. And then we are going to be completely ready to go here. So hang on a second. Let me just go to full screen on the slides. And let me get the chat back open. Let me put this over here, and let's get this chat back open. Okay, now tell me that you can go ahead and see the slides, and that would be fantastic. So go ahead and put that in the chat. Okay, you can see me. You can see the slides. We are ready to go. This is all about you, and feel free to ask questions at any time. We may stop at different times to go ahead and answer some questions here, but put questions in, and I'm going to ask you a few questions there as well. So again, keep putting in who you are, where you're from. So Pooja and Michael and Erica and Janine and Susan, and we've got so many of you on. We literally have hundreds of you on right now. So welcome, welcome, welcome to all of you. We are going to jump right into this. We are talking about the business of Botox and the Botox blueprint and how to add up to $50,000 a month to your dental practice with Botox and fillers, whether you're brand new, which I think most of you are going to be brand new, maybe you've never touched Botox or fillers or thinking about adding this to your practice for a while, or even if you're an experienced injector already, we're going to have something for absolutely everyone for that. So happy holidays to you too, Angela and Kieran. Welcome to you. And again, Brigitte, we're not going to get to everybody, but you can see this is from all around the United States, even a few international for this. Even if you're burned out, losing patients, or think the market is saturated, I'm going to keep coming back to this one part, and we welcome office managers too, Nancy. I just saw you go ahead and pop up here. I just want to say we are at the end of 2025. How was this year for you in terms of your dental practice, in terms of production, right? I mean, a lot of dentists have been going out on that, maybe this wasn't the best year. I hope it was better than that for you, but was it one of the boom years in dentistry? Well, you're going to see, I'm going to show you some of the latest statistics that literally just came out about a month ago, and you are going to go ahead and see that dentists are not quite doing that well, certainly this year, and this is the most recent statistics we're going to get to. So let's jump in. But just to answer Farragut, to answer your question, yes, Botox and fillers can be done by dentists in New York. We've been teaching in New York for probably 18 years already, and so we have taught thousands, literally thousands in New York. We've taught dental hygienists in the states that they can do them. We'll get to all of that. Like I said, keep asking questions. So at the end, there's going to be an offer that the AAFE is going to offer, which is a one-time, one-of-a-kind offer till midnight tonight. But let's first learn about the Botox blueprint for your office. This is under the American Academy of Facial Aesthetics. It's the most trusted name for injectable training, especially when it comes to dentist because we have trained over 22,000 dentists in the last 18, 19 years. I am a regular at dental licensing boards constantly, and we give our courses ourselves, probably about 500 courses a year on Botox fillers, individual courses, and we do work with the American Dental Association and many other dental associations for that. We have full-time faculty to help you. We have over 80 faculty. You'll see them all a little bit later on, but you're going to discover how this is going to grow your practice better than just about anything else. The fact of the matter is that most dentists are struggling. You're exhausted. Patients visit less often. Insurance still is ridiculously low for that. I'm not telling you anything you don't know. If you're a practicing dentist, and feel free to agree and disagree in the chat. Again, this is really going to be about you and your participation for all of this. And every time you want to grow, everybody says, oh my God, you got to buy this expensive piece of equipment or do all of this, training that costs thousands of dollars for this. We're going to turn everything on its head here, and we are going to show you a cash pay treatment, fee for service treatment, where none of this insurance nonsense, and it is the most reliable, recurring, high profit revenue stream that you could possibly have in your office. And what you're going to walk away with is you're going to learn how to seamlessly integrate injectables without any new staff members or equipment, why patients already want Botox and fillers because they're getting it from someone else, and the system that we use in AAFE to add $10,000 to $50,000 a month in new patient and new treatment. And you know what? Even more valuable than new patients is what? Your current patients. And certainly we're going to talk about all of that. So stay to the end to discover. This is the #1 system that dentists use to add $50,000 a month or more. Why your existing patients are already paying someone else for Botox. You'll see why. The hidden ROI. This is the most profitable you could be. And how we are going to get you started within 30 days, or I will tell you, for most dental practices, you can start treating paying patients within 14 days, and we're going to talk about that and a special bonus at the end for this. And this is not theoretical. This is about proven growth that we have done for so many dentists just like you, and you're going to learn new ways to run your practice. Everything you see is already working for lots of dentists here and AAFE dentists, and certainly stay to the end when we'll get there pretty quickly here. And again, feel free to go ahead and ask and answer questions. Who this workshop is for: general dentists who want to grow without stress, dentists who need new revenue, recurring revenue streams. That's going to be important. We're talking about recurring revenue. We're not talking about one and done. You'll see the difference. And certainly someone that has multiple practices, how to really get higher ROI out of your practice. But you will not have to invest in fancy equipment, big marketing budgets, extra staff, insurance reimbursement, all this time wasted in learning something new. That is not what this is about. This is about delivering something that your patients want already. My name is Dr. Louis Matzmacher, president of the American Academy of Facial Aesthetics. Many of you have been on webinars before, or you've seen my articles in just about every dental magazine or lectures over the years about no prep veneers and about implants and about perio and regenerative periodontics and lots of different things, which I'll save way to the end if you're interested in the gum builder. I know that's a hot topic today as well. I've spoken all over the world for that. There is my email. There is the AAFE's email, the American Academy of Facial Aesthetics, if you want to take a picture of those emails, and feel free to contact me afterwards as well. And we'll get to individual states. We'll answer some of those questions later on. New York and California are always, the biggest questions, and we give so many courses in those two states, and we'll certainly dive into that a little bit later. But my own story is I ran a group practice doing everyday dentistry for many years, and like you, dentistry it doesn't just feel like a grind, it can be a grind. Not that I don't love it, I love every aspect of dentistry, and I've taught most aspects of dentistry over the years too. But financially, it was good, it's good for all of you, but there's certainly a lot more. So what happened? How did I get into Botox and fillers? And this is, again, nearly 18 years ago, maybe even a couple of years more than that. For that, the Ohio Dental Association put out, or Ohio Dental Board put out a bulletin just out of the blue. This is in 2007, saying, you know what, dentists can do Botox and fillers in the state of Ohio. Someone must have asked. I don't know what triggered the entire thing. And my wife saw this bulletin, and she said, "You better learn how to do this." And I said, "Why?" She says, "If you don't, I'm going to go pay someone else because I'm going to be getting it." And that was a big aha moment for me. I like to tell the story because I, like many of you, maybe it's the dental mind, we're somewhat frugal. That's a nice word for cheap, but we're somewhat frugal. And I figured if I do it, it'll probably cost me less than if she goes somewhere else. And not only did I learn it, and I've been teaching for 40 plus years already, this was so valuable for TMJ, for trigger points, for oral facial pain, but also for facial aesthetics, because we've been doing dental aesthetics for so long. That is really how I really got started in all of this. But like all of you, I focused on what patients needed: fillings and crowns and implants and root canals. But there's a downside to that, right? I really wasn't giving patients what they wanted. By the way, I've been doing and teaching veneers also for many, many years, but that market is really relatively small, right? Would you agree? There's not that many patients that can afford a 5,000, 10,000, 15, 20,000 case of full mouth veneers. And I've done many of those, but how many times a year are you really doing those kinds of cases? Even those of you who are into implants, how many full mouth implants a year are you doing if you're trained to doing it? And then getting trained to do those cases is going to cost you $30,000 and more. So, and I'm going to get to this because I think this is a really, really important point for that. But what I did learn is that patients want Botox much more than everyday dentistry. Botox is today, in 2025, going into 2026, mainstream dentistry. I mean, we have shown that so many times. We've trained almost over 10 to 15% of active practicing dentists. It's part of dentistry at this point for that. But the difference is my practice grew faster than I could have imagined. Patients love it. They paid in cash. Like I always say, there's none of this insurance nonsense. And it's the most fun you're ever going to go ahead and have in dentistry. And let's take a look, because patients have priority. In this video, somebody sent me, came right off of TikTok, and look at what the patient put money into versus what they really needed. Take a look at this.
Work, I am about to treat myself and get my nails done.
Oh, go to the dentist. For the love of God, save the nail money and go to the dentist.
I don't know who this guy is, but he has millions of followers because he does do some of these sarcastic videos. But that's the point. She's spending it on nails. She's spending it on everything else. And look at her mouth. We see that all the time. You see that all the time for that. How many times has a patient told you, you know what, doc, you've told them that tooth number 19 broken down. They need an endo and a crown. And they say, I don't care about that. It's in the back. Nobody can see it for that. And that same patient is going somewhere else to get Botox and fillers. And believe me, you're going to start asking your patients, have you ever gotten Botox and fillers as part of their medical history? You will be shocked at the number of patients who say yes, and you've been chasing them for that crown and endo for 3 years, all right? Or any needed dentistry, because people will pay for what they want, not necessarily what they need, but people will pay for what they want. So after we got started, then the revenue really skyrocketed, and we were doing pretty well already for that. People, they're healthy, happy patients. They're thanking you. They can't wait to come back because, as you're going to see, Botox lasts for 3 months. and fillers last for 6 months. We'll show you some clinical video too, so you can get an idea. So this is recurring revenue. Whoever thought that patients would come back, would pay for a service that needs to be redone in 3 months, maybe 4 months, over time, maybe 6 months, but it needs to be redone. We have such a one and done brain in dentistry, like, and by the way, we feel responsible if it doesn't last for 5 years, right? I mean, we have our brains have been totally messed up, from that. While the rest of the world is doing Botox and fillers, every med spa in town, every nurse, right, nurse practitioner. I'm not denigrating anybody. We train them all, but an RN is given as a med spa a block away from you, and she's cranking it out with Botox and fillers, and we're still trying to figure out: do patients really want this? The answer is yes, by a mile. So no more grinding for insurance pennies, no more burnout. You're going to really get paid for what you want, and you're going to build a dream practice and get paid what you really are worth for that. And that is really, sorry, I'm going the wrong way. For that, what's the pain that most dentists really feel? Patients visit less often. That's been proven already, certainly in the last couple of years. Insurance caps still at $1,000 to $2,000. By the way, I've been in dentistry over 40, close to 45 years. We were complaining about this 40 years ago, saying that, you know what? I mean, honestly, when I graduated in 1981, we're saying, how can it be that insurance caps were at $1,000 to $2,000? $2,000 would be generous in the 60s, and here it's the 80s. Well, here it's 2025, and it's pretty much the same. It hasn't really gone up. Equipment and staffing costs have gone up. Burnout. I mean, tell me, you may or may not want to say in the comments if you're burnt out. But do you think, I won't put it on you. Do you think many dentists are burnt out? Put that in the comments, just yes or no. Are many dentists burnt out? You go to dental meetings, you talk to friends who are dentists. Are they burnt out? I mean, overwhelmingly, I talk to dentists all the time, and they are burnt out. And the sad part is, go ahead and tell me if I'm wrong. And yes, they may be frustrated. That's a very good way of putting it. Frustrated, burnout. There's a very fine line between the two for that. And it may be you or it may not be you. But I mean, I see dentists that they've only been dentists for 5 years. They've been practicing, and they're burnt out. Certainly 10 years, 20 years, 30 years, you need, and I've always said this, and again, any of you who have ever taken any of my courses in the past on clinical dentistry, I've said this so many times. The key to fighting burnout is learn something new. Learn something new. That's what makes everything fun. Any area of dentistry, any new technique, this by far is the most fun you're going to have in dentistry. Here is from the ADA, American Dental Association. And again, the AAFE, we have a great partnership with the ADA, but this is from their Health Policy Institute. This literally just came out a couple of months ago. Take a look at this slide. It may scare you a little bit. For this, look at 2010 and look at the average dentist, general practitioner, was making $267,000. It is now 2024 from last year's, the end of last year. It is, for inflation adjusted, it's dropped by $60,000. It should have gone up, right? And we had a little bump, before COVID. We had a little bump after COVID. But even in the last 4 years, look at that drop for inflation adjusted. And many of you are probably feeling it. It's time to do something different. And we were going to go for the most popular services that are out there. And we're certainly going to talk about that as well. Look at this. This is from the same thing. And you can download this yourself and see this. This is literally from a couple of months ago for that. More dental schools leading to more dentists. So there are more dentists getting pumped out, right? The inflation adjusted income is coming down. More dentists are getting pumped out. This one is really a little bit scary. And that is, look at this. Dentists have to work longer. Their career span is increasing over time. Why are they working longer? Not because they want more money, because they need more money, right? You even look in 2001, the average dentist career was 37 years. Now it's 41 years. Okay, it's gone up and down a little bit, but certainly it's been pretty consistent for this. Dentists are having to work longer for this. So is it even possible to grow in this environment? Absolutely, but you've got to stop relying on insurance-driven dentistry because I don't want to give you the wrong idea. I am not one of those people that say drop all your insurance. That's a decision you may or may not want to make. I don't think it's wise for most practices because you need that income, but it's all this other thing that you should be adding to your practice. And let's take a look at the different things that many dentists feel they should be adding to their practice. But the cost is so prohibitive and it's for very few patients, but we'll get to that for that. But most dentists do try the wrong way to grow their practice. Do not believe the salespeople that come in saying, oh, if you buy this CAD cam, I'm all for a CAD cam. I'm all for Cerex and CAD cam. All those things are really great, but they're a huge investment. That is not one and done, by the way. That investment, you're going to have to buy upgrades. You're going to have to buy more machines. All that's fine. And that's fine. It can be a great investment. But buying an expensive piece of equipment, a laser, anything else like that, which we have them all, but buying that is not going to be something that patients care about, right? And not going to be the ticket to a successful practice. You're the ticket to the successful practice for that. You're adding services that patients may or may not want, in many cases don't want. You're hoping insurance pays more. That is a failed way to look at this here. So we're going to go over the 3 big secrets to practice growth, including the strategies, including how to integrate injectables, and then smart marketing strategies. By the way, the marketing strategies, most don't cost you a penny. And that's going to be really, really incredible. But I want to turn this back to you and ask you all a question here. If you ran a service business, which you do, okay, which services would you offer? Which would make you the most production? And put it in the chat, 1, 2, 3, or 4. Is it number 1, the service that everyone wants and is affordable? Is that going to bring you a lot of production? Number 2, a service that very few people want and is affordable? Will that bring you production? Which one will bring you the most production? How about a service that everyone wants and is expensive and only a few people can go ahead and afford, or a service that very few people want and is expensive, but they can't afford it? Obviously, the number 1 is going to be the answer. Number 1 and number 3. I mean, we want a service that everyone wants is affordable. We also want a service that everyone wants that is expensive. Few people can afford it, but when they afford it, that's a $5,000, $10,000, $15,000 case. That's really what we want. Obviously, though, the big answer is going to be 1. So why in the world do dentists spend so much time and so much money? And I'm not saying you shouldn't, but it shouldn't be the first place you're going to go if you're going to grow your practice. Well, I'll ask you the next question. Go ahead and put this in the chat there too. Which of these services do you think is the most popular? Number 1, whitening. Number 2, veneers. Number 3, implants. Number 4, Invisalign. Number 5, endo. Number 6, perio. Which one of these do you think is the most popular among patients here? Okay, put it in. I want to see a lot of participation. Wake up if you've been sleeping for that. Go ahead and put it in. And there's no right or wrong answer. Your practice may have a completely different, experience than everybody else. So you see a lot of whitenings. Keep putting it in. Come on, everybody wake up. Let's go. Keep putting it in. Perio, maybe. I don't know if you're a periodontist, Newton, so that's why it would be pretty good in your practice. Certainly whitening is popular. Certainly, because it's everyone likes white teeth and it's really affordable. Veneers is popular. Implants is popular. But how many people need veneers and implants? Invisalign, as you see here, is popular. How many people need Invisalign, right? So it's popular, but there's, it's not made for everybody. Endo and perio, I don't know how popular those things are. Let me throw one more thing in there. Botox. Now tell me, put it in the chat. Which one service is the most popular, by the way, that you think, even if you don't offer it, okay? Of all these, which one is the most popular? This is not even a close. Okay, Botox is the most popular aesthetic service in the world that's delivered by a healthcare professional. It's not even close. Whitening does not even come close to Botox. What is it about Botox and fillers that makes them so popular? This is before and after is one of the things that does it. And also, listen closely, every single patient, nearly, not the kids, but every single adult patient starting from the age of 20, okay, is a candidate for Botox and fillers. That's what makes it so popular. Are all your patients a candidate for implants? No. Many of them will never need an implant. Are all of them a candidate for Invisalign? A lot, but not all of them. But there's a high price tag to that. Are all of them candidates for veneers? Are all of them candidates for endo or perio? No, but they're all candidates for Botox. So if you were running a business, a service business, which you are, what would you go ahead and offer to your patients? What must you have in your practice? You can have all the other stuff. You can have the expensive equipment, but what's the one thing that's going to bring you in the most consistent and most income? It's going to be injectables every single time. I could spend, by the way, this before and after is spectacular and is more than just cheeks, more than just lips. It's cheeks, lips, it's Botox. It's also lifting PDO threads. There are 4 different injectables, main injectables that we teach. We teach a lot of others as well, but these 4 are the crux of everything. And this patient got them all. It's a different face. And she is so happy. And by the way, she's going to be paying for this over and over and over again. Why? Because Botox lasts for 3 to 4 months. Fillers last for about 6 to 12 months, depending on the filler. All the injectables are recurring revenue in your practice. Invisalign recurring revenue? No. Implants? No. Veneers? No, or at least you hope not. Whitening can be a little bit, but most dentistry is one and done. And here really is the ROI showdown, the AAFE. Not really AAFE, it's injectables versus other disciplines for this. If you're going to, again, I'm all for learning implants. I'm all for learning Invisalign. I think they're really important to have in your practice. But the cost of learning these things, the time, the cost involved of learning implants to getting to your, all on 4 or all on 6, because I'm much more into all on 6 than all on 4. I don't know why we had to get stuck at 4, because that's going to have the highest failure rate for that. But full mouth implants, that takes $30,000 to learn. Okay, a lot of restorative courses. I just saw a whole restorative symposium, which is restorative, right? That would cost $20,000 to learn. Invisalign is going to cost you $10,000 to $20,000 to learn. There's really a lot of different levels of Invisalign for a few patients. And again, how many total veneer patients are you going to do in a year when you're taking all these courses on veneers? I'm not knocking them. I do all that stuff. I've taught all that stuff. But just in terms of getting started, what you also need is that consistent revenue, that giving services that patients really want, not whitening, because that's, again, not for all patients. Botox and fillers at the least, and the cost to learn it is much lower. We'll get into that a little bit later on. There's no lab fees, short chair time. The time to deliver these things is minutes. There's no equipment. Your only investment in learning Botox, fillers, and TMJ, and I'm going to show you clinical videos, is one thing. The investment in you, your hands, and its skills that you are going to have forever. There's nothing else that even comes close. So you've really got to go ahead and add this to your practice right now. And we're going to talk about why your practice is the best situated for delivering Botox and fillers for a lot of reasons coming up. And enjoy all the before and afters that are coming out. So it's a huge opportunity for that. Millions of Americans spend billions on Botox and fillers every single year. Your patients are already getting this. I got news for you. Not just your patients, your family and friends are already getting this from someone else. The patients coming in tomorrow to your practice, or that came in today, came in the entire 2025. And this, I really want you to do this because it's important to know anyway, especially if you do aesthetic dentistry and veneers or implants or anything else like that. it should be on your medical history form. And for first of all, from a medical perspective, and second of all, from a marketing perspective, you're going to see how many patients have already been getting Botox and fillers, especially when you start delivering Botox and fillers. You want that on your medical history so that you can see, oh, you already get Botox and fillers. You know, we do it here, and you show them before and afters, et cetera, and you'll really, I mean, that's the way to really build it. It's just incredible. By the way, I will tell you this, and some of you will be shocked when you go to the office tomorrow. Why don't you ask your team members who of them get Botox and fillers? Okay, who's had lip filler? Who's had a little bit of Botox? I would bet that you will be shocked in your office. Okay, ask people in your office, the people you're sitting next to all day, every day for weeks at a time. It's really going to be a big eye opener for you here. Dental insurance, is capped, and there's nothing about this. And by the way, we're not just talking about aesthetics. We are talking about the oral facial pain, and we're going to show you a little bit of just about everything here. What are the differentials in this? First of all, Botox and fillers is not new to dentistry. It's over 20 plus years, nearly 20 years that we've been teaching it. It's been in dentistry even longer than that. 98% of Botox and filler use have both therapeutic and aesthetic benefits all at the same time. That's really, really important to know. And by far, there's nothing even that comes close. Botox and fillers are the safest dental procedures that are out there. I go and I've spoken to nearly every single dental board in the U.S. I am a regular speaker at the American Association of Dental Boards. Yes, the dental boards actually have their own association. They've got 2 meetings a year. I spoke last year. I usually speak every other year about Botox and fillers. So you can't say anymore, I'm not sure if I can do this in this state or that state. You can do it in every state. A couple of them have nuances that we can answer questions about, but you can do this in certainly every single state. Why? Because 98% of Botox and fillers have both therapeutic and aesthetic benefits at the same time, and it's completely safe. Botox only lasts 3 to 4 months. What the worst thing that's going to happen if something goes a little wrong, a muscle gets a little twitched that shouldn't, and drops an eyebrow a little bit with good technique is not going to happen to you, because we are all about precision and safety and anatomy and technique when you learn it, but it goes away. Nothing else of dentistry. You drill a hole in somebody's mouth, for an implant, and you go through a sinus, you've got a serious problem there. It's not going away so fast for that. I mean, there's a lot of other things you do in dentistry every single day that do so much collateral damage. You're not going to get that with Botox and fillers for that. And these are a partial list of the aesthetic and therapeutic uses of Botox and dermal fillers in dentistry, and certainly on the face, head, and neck. But we're going to show you an example of some of that too. And like this before and after is just huge. I mean, you all can learn to do this, literally learn to do this for that. It takes a little bit more in Botox and fillers, and it takes some threads there as well, but we'll leave threads for another time. We will just focus on Botox and fillers. So this is all documented. We've been doing it for a long time. And what's incredible? I get this all the time. Dentists say, I'm not in New York, I'm not in California or Los Angeles. Are my patients in my little town, in this Wisconsin really going to want it? Yes. I will tell you a little secret in the AAFE, and this is after 18 years of training, $22,000. You know some of the most successful dentists that we have that do it in the AAFE? They're the small town dentist. There is, I should have put a picture of him, my good friend, Dr. John Hendrickson. He's in a little town in Indiana, and he is almost the regional center for Botox and fillers. And this guy is so well trained. He does implants, Invisalign, veneers. He does just about everything. He's taken just about every AAFE course. I mean, his wife is a dental hygienist who is now a laser technician in the office. They have their regular dental practice. They have a whole dental medical spa, and they are killing it. And they're in a little small town in Indiana. He's one of the most successful practitioners that are out there. And I can give you dozens and dozens more of small town, big town, it doesn't matter where you are, patients are getting it everywhere. And this is a beautiful restorative dentistry case by Dr. Naomi Eladad. And I'm on, everyone's got their WhatsApp chats, and we've got the big WhatsApp chat. It's got like 800 dentists, and everyone, shares cases. And I just snagged it from there. And look, this is an exquisite restorative case. Okay. What's frustrating to us about this case? How long will it take you to do this? And especially on that level, to make the teeth look that realistic. That's easily 60 to 90 minutes. For many of you, it would take you a little bit more. How much can you charge already for this case? $700 to $900, and this is one and done. Okay, you finish the sentence. Put it in the chat. I want you. I'm not going to go further till many of you put this in the chat. Finish this sentence. Patients expect this case to last what? Put it in the chat. That did not take. Come on, everyone else, finish the sentence. Finish the sentence, okay? Okay, did that take very long? You till death, which is forever, for eternity and beyond. Thank you. You've got that. I mean, am I right? More than God intended, that's for sure, right? I mean, tell me if I'm right. The word popped up in your head when I started the sentence, right? I mean, we all know this, right? And will it last forever? Of course not. And when it doesn't last forever, who does the patient blame, right? They blame us. Who do we blame when it doesn't last forever? That's how kooky sometimes we are too. We have this almost, we feel bad if it doesn't last forever. I mean, we do. I feel bad to this day. I feel bad, and I know I shouldn't, right? Because the patient, decided to bite into the hardest bagel they could find on earth and break it, and oh my God, they're broke. That dentist stinks, right? By the way, will they put this on their social media? Will they even realize how beautiful this is? Put that in the chat. Does the patient even realize? Look how gorgeous this case is. It's amazing. Okay, I mean, it really is amazing. They won't put it on their social media. They won't appreciate this work. They really don't care. They hope that you're going to charge, less for it, for that. Totally different when it comes to facial aesthetic dentistry and Botox and fillers here. This is the same 90 minutes. This is a $3,500 recurring revenue case. Does the patient appreciate this work? You bet. They look at it every single minute of their lives. Will they put this on their social media? You bet. Will they pay again in 3 to 6 months if that's what it takes to look this good? And by the way, not every case is $3,500. But if you're doing a Botox case for $600, that took you exactly 5 minutes. And those of you who do Botox already, on patients are probably saying, why is he saying 5 minutes? Because the delivery takes about 1 minute for that. Okay, but we'll get to that. For that, it's a totally different experience. And this, you're waiting for insurance, et cetera, et cetera. And, if you want to upcharge because it's a really premium service, it's going to be hard to because of insurance. This, you don't have to deal with any of that nonsense for that. And just so in case you're wondering what we're doing here, again, when you really get into this, nearly every case you're doing is going to include 4 different injectables. And this is lifting PDO threads. Again, don't worry about that now if you're new. Smooth PO threads for collagen biostimulation. Certainly Botox, certainly fillers. That's how she gets this the cheeks. That's how she gets the snatched jawline. That's how she gets the tightening in the neck. All those things together for that. I'd rather spend my 90 minutes on that. Patients will absolutely love it for this. And again, this is an office production survey that we've done. And I'm going to show you a clinical case in just a minute. Here that we do about once a year. We like to do, we've got many members. We've got many dentist members. We do also train nurses and physicians and nurse practitioners and all the healthcare professionals, but we train probably 70% of who we train are dentists. Probably 75% of our team, of our faculty, are practicing dentists, just like all of you as well, from endo to perio to oral surgery to orthodontist to lots of general dentists, and all of them, and they're all doing aesthetics there too. But bottom line, the average dentist who does Botox and dermal fillers are seeing, and this is a year later after they started, an average of $32,500 per month in additional production in addition to the rest of your practice. Those who do the level 1 Botox fillers and TMJ oral facial pain training, that average is $48,500 a month. Now, some are doing less. It really depends on you and your focus. Some are doing a lot more than that. That's why these are average numbers, but those are really substantial average number. That's not their total monthly. That's in addition to whatever else they were doing before. And so that is why Botox and fillers by far is the #1 ROI procedure in dentistry. There is nothing else that comes close. Why? Because it doesn't take very long. So let me show you a Botox case, a quick Botox case. We'll just show you some of it. I'll just play it and you can get an idea. Those of you who do Botox already, you'll learn something. Those of you who don't will really start to appreciate this procedure. And the few minutes that it takes, this one takes a little longer just because it's somewhat of a teaching case here. But go ahead and take a look. Here we go. We are in the AAFE Training Center today, and we are treating Saria, and you've seen this face in lots of AAFE education here, and we are giving her a full face Botox treatment pretty much, and this is what we're doing. So we're going to watch everybody go ahead and take care of her. So you can see, first of all, we're treating her forehead here. As you can see, botulinum toxin, ComfortTox syringes, the best one and the most comfortable. And you can see she's really a great patient as well. Now take a close look at her. We're going to try to get around everybody's cameras here. Take a close look at her. She has got very, very shallow eyes, and shallow eyes means that we are really going to change the dosaging of our botulinum toxin to adjust, because if you overdose on botulinum toxin, not that kind of overdose, but if you overdose and give too much botulinum toxin, then on someone with shallow eyes like this, then that can really drop their eyes. And if you inject patients with botulinum toxin and Botox and have no idea what I'm talking about in terms of shallow, medium, or deep eyes, then you have not been AAFE trained, and that is when you get a lot of droopy eyebrows, and patients absolutely hate that. And someone like Saria here really needs an adjustment to make sure that you are treating the frontalis and will not drop those eyebrows, because that's the last thing you would want, Saria, right? I mean, you don't want dropped eyebrows.
No, thank you.
Nobody does here. So now that was great, and that was good. You can see a little bit of bleeding. That is very normal for any kind of botulinum toxin treatment here. So now keep going there, Sydney. You're doing great. And now we are doing the glabella region, and you can see right here, this is the procerus muscle. We'll try to get a good view as we go around everybody here, right in the procerus muscle. Now take a look at Sydney's technique here. This is the classic AAFE technique. Look how she's holding the muscle. She's holding that muscle to really isolate the botulinum toxin into that muscle, because if you don't, especially around the eyes, and any botulinum toxin leaks down into the eyelid muscles, then all of a sudden her eyelid droops, and that is completely preventable with good technique. And that's another thing that I'm sure Saria would not want, is an eyelid droop and not be able to pick up that eyelid for a few weeks, because that's not fun for anybody there. So that looks just great. How you doing so far, Saria?
Very good.
Okay, she's doing good. And this is her 1,242nd treatment of Botox, I guess, over time. And again, you've seen her, and we'll show her before and after from when she started. We were just talking about it before. Now you are going ahead and just turn that a little bit more. Turn her face a little bit more. That's good. And now we are going to go ahead and give her the orbicularis oculi muscle injections for the crow's feet here. By the way, and Saria is an amazing Pilates instructor, the best in Cleveland. So if you need a Pilates instructor, you can go see her. But when she first came to us, she really came to us a lot for oral facial pain. Every single injection that you are seeing right here is going to go ahead and treat two things, the aesthetics and the therapeutics on her, in terms of really calming down these muscles, taking care of oral facial pain, migraine headaches, TMJ, which has been much better on her ever since ever since we went ahead and treated her for the first time. But really, she came in for orofacial pain. But that's the amazing thing about botulinum toxin treatments, and why patients love them and why clinicians love them, is because you really get that dual effect. I mean, what other treatment makes you look great and feel great here? And here we are already done with the crow's feet orbicularis oculi. And if you saw just right before Sydney started, she measured out, you want to be about 1.5 centimeters away from the actual corner of the eye, and always injecting away from the eye. Why does anybody inject towards the eye? That is when you get double vision and all kinds of side effects. Most of the side effects, if not all of them, are perfectly preventable with good technique and knowing the dosaging that you need for botulinum toxin here. Where are we going next here, Sydney?
We're gonna go, let's do the masseters. We'll do masseters next.
Okay, now her masseters, by the way, again, we'll have to post the before and after, but her masseters are amazing, because when she started, they were giant masseters for this face, and it really squared off her face, and she did not like it. Whenever you're ready, you can go ahead.
All right, go ahead and clench for me.
And what Cindy's doing, again, classic AAFE technique. Grab that masseter, anterior, posterior. You want to be in the middle of that, if not a little bit posterior. Why? Because there are other muscles that attach to the anterior part of the masseter that if you hit them with botulinum toxin, guess what? All of a sudden they will have a droopy smile. So you can prevent droopy eyebrows, droopy eyelids, and droopy smile with knowing your anatomy. That's the first thing, first thing is knowing the anatomy and making sure you have really, really great technique. And that all comes with AAFE live patient CME certification training, as you can see. So we're going to the other masseter here. By the way, watch the technique here. How do we give these injections? It is faster is better. Go in, give it, and get out. And that is exactly the way you should be giving botulinum toxin injections. You get no points for going slow. Actually, going slow bothers the patient a lot more. And you all want to be known, and that's the way we train in the AAFE. You want to be known as the most comfortable injector, because then patients will flock to you and they will keep coming back to you. So great job so far. How's it feel, Saria?
It's very comfortable.
Yeah,
very comfortable.
Now let's show you before and after on Saria, all the way from when she first started a few years ago. Look at those masseters. They are huge and barely had any cheeks. And we did a lot on her. Look at all the different things. We brought those masseters in, popped those cheeks out. She has had smooth PDO threads for collagen building. She's had lifting PDO threads to really snatch back that jawline. Now we created a heart-shaped face on her. She couldn't be happier. Plus, take a look at those lips. We haven't had filler in those lips. That is purely from the microbotulinum toxin lip flip. So you can learn to do all this too. It's time for you to get AAFE CME certification trained with our live patient training. We can't wait to see you at an AAFE course real soon. And that was, again, what, a 5-minute video? I mean, that did not take very long to do that. That by itself was probably about $1,000 worth of Botox. That's going to be really hard to beat. I mean, really hard to beat for that. Plus filler, plus, you know, I mean, a lot of services you can do. This is really deep. But the beautiful thing about this is that, again, unlike, you know, when you learn implants, you take an initial implant course, you're putting in single tooth implants, which are a lot, you know, on people that need it, takes you time to really get acclimated. You will get back to your practice. And after even a level 1 Botox fillers TMJ thing, I'm going to show you lip fillers. I'm going to show you some trigger point therapy as well. You are going to start, you can literally start treating paying patients within 14 days, and you will be ready. Why? Because we will make sure that you are ready. I love showing this patient because how old do you think this patient is? Put it in the chat. I haven't bothered you for the chat for a while. Tell me how old this patient is. How old do you think this patient is? Right? 20, 25. Do I hear 30? We're going up. 28, 34, 31, 27. I don't think she's not going to be happy that you think that she's you know, that she's in her 30s. She is not going to be happy about that. This patient is 23 years old. Did you know that in all healthcare practices that now do Botox and fillers, okay, Gen Z and millennials, okay, so you're talking about the 20s, okay, and then starting, the millennials are starting to get a little old, okay, so they're pushing into the early 30s. Nearly 40% of every med spa practice is now Gen Z and millennials. What does that mean? Is that they are getting started young. I cannot believe it when I go into the AAFE med spa and we employ 3 nurses and a few are around the country, nurse practitioners, because we've got AAFE med spas in a number of cities. I cannot believe the patients that come in today. For lip filler is almost automatic when they're 20, 21 years old. And then they start getting Botox when they're 22, 23 years old. Now look at her. I really want you to appreciate this. Did she need it? Did we really reshape her face? Yes. So yes, she needs it. So when I said before that nearly every adult patient that comes into your practice is a candidate for Botox and fillers, different than implants, different than Invisalign, different than veneers, the answer is literally yes. And she'll be getting it for the rest of her life because it's recurring revenue. It's going to keep coming, and she needs it over and over and over again. And to this generation, by the way, this is just like getting hair and nails, which they spend a fortune for as well. And by the way, again, I don't know if you really know what's going on in the world. The crazy thing is that do you know how many teenagers, I'm talking about tweens, I'm talking about 10 to 12-year-olds are in Sephora, which is for the men on this, I had to learn this too. That is a huge national cosmetics store, or Ulta's, and they have so many products geared to 10 to 12-year-old girls, maybe even younger than that. I have a bunch of granddaughters that are, go all the way from 18 years old all the way down to probably 2 years old, and the ones in the tween years are already putting on lip balms, and I don't even know what they're putting on. These are your patients, and you're going to have them for a long time. This is why it's booming, by the way, because nearly 40% of the practice is young people. Now they're going to be getting it for a long time. All right, now number 2, seamless integration into a dental practice. This is going to fit right in. Do you know when you buy a CAD CAM, when you buy a CEREC, when you buy a big piece of machine, there's a long learning curve. You've got to change your workflow in many situations. Not here. This is so seamless into your existing practice. And let me ask you all a question. Again, I'm bothering you with the chat because I really want you to drive this home. And I want this to be really about think about your practice a little bit. Right now, how many of you have what's called capacity in your practice right now? Do you have empty chairs? Do you want to fill those empty chairs with appointments that take anywhere from 10 minutes to 30 minutes right now, where you could go ahead and the treatment cost of those, the patient fee is going to be anywhere from $500 to $2,000. Do you have the capacity right now? Yes, that's probably why you're here. Because, by the way, so many of these patients I take right off of hygiene. We check them for hygiene. They want a quick Botox appointment. They want lip filler. I've got a chair. Doesn't matter what else I'm doing. I've got the 10 to 15 minutes, which I can do while the assistant is making a temporary crown. Takes her at least 10 to 15 minutes to go ahead and do that. Go stick the impression in, come back and finish. I mean, there's so many ways to do it. It's just seamless for this. Dentists worry that my staff won't know what to do. Patients won't go ahead and take me seriously. I don't have room in my schedule. You all have room in your schedule. You wouldn't be here if you didn't have room in your schedule for that. I mean, that exactly is it. There's nothing that you will ever learn as a new skill or treatment in dentistry that will fit in so well. It is the perfect fit. Why is it the perfect fit right now? You already have the patients. There is not another healthcare professional. Some nurse or nurse practitioner starts a med spa, or physician starting the med spa, they got to get patients, and that's going to take some time. You have the patients. If you are a part-time to full-time practice right now, okay, think about, and you've got at least one chair of hygiene going pretty much 3 days a week, 5 days a week, whatever it is. You've got 100 patients coming through your office every single week. No, some of them are kids. You've got 60 adult patients coming through your practice every single week. Many of your practices, you've got 100 to 200 coming through every single week. If you've got multiple hygienists, maybe multiple practices for this. If you have hygiene running, I've got 8 adult patients a day that I can offer Botox and fillers. And again, probably some of them are getting them somewhere else. They love getting it in the dental office. You have the team, you have the time, you have the capacity, you have the recall system. No one else has got a recall system. There's nothing that has ever fit into dentistry better than this. Even if you don't, it's got nothing to do with new patients. Most of your revenue is going to come right now to start from those patients that you are seeing in your chair tomorrow, right there, using skills that you already have. You got the hands and you're good with a needle. We know that because dentists are the one healthcare professional to give the most injections. You just got to learn a different injection. It's a tremendous opportunity. Here is the bigger opportunity right now. I don't know if you really appreciate this because, again, we talked about burnout before. It feels like a grind when you go into the office. The big advantage we have is patients come back. Why do patients come back for recall to you? Why is that? Because they trust you. If they didn't trust you, you wouldn't have the patient that comes back for recall after recall after recall. Why aren't you doing more dentistry on them? They either don't want it, can't afford it, or they don't need it. So now you have something else to go ahead and offer patients who already know you, who already trust you more than they know. Patients have a relationship with their dentist much more than they have with their physician. They barely see physicians anymore, right? And they don't see a nurse practitioner or a nurse or a primary care as often as they go ahead and see you. Now you have got so many new services that you can go ahead and offer them for that. You add Botox consultations to every hygiene appointment. By the way, my entire team, we'll talk about the team in a minute, knows how to do a Botox consultation, and they're usually better at it than I am because it's more peer-to-peer, because 92% of people getting Botox and fillers are female, and they're female, and it's a much easier conversation. For that schedule, do you have 15 minutes? I have the 15 minutes. I don't know about all of you for that. I'm sure, and we've got busy practices for that. And you train your team to assist. I pretty much tell patients I'm the technician. I'm going to come in, I'm going to go do the treatment, but they're going to talk. My team is going to talk to them first. And by the way, we've solved the problem of team of staff turnover, and that is Botox, because they're all getting Botox. They'll never leave us because they want to be young forever. We literally have solved the problem of team turnover for that. We always treat the team first. In our practice, we do not charge the team unless they want it like all the time. Then we may just charge them costs. That's going to be up to you. Initially, you're going to practice on them anyway, and they've got to look great, because if they look great, then your patients are going to see, that this is exactly what I want to go ahead and look like. And by the way, your team, okay, when you start doing Botox in the dental office, they will talk more about injectables than any other area of dentistry. We tried to train our team for years, talk about Invisalign, talk about veneers, talk about whitening, talk about all of these great things that we offer. And they're talking about their vacation, and they're talking about their pets, and they're talking about everything else. They got, the hygienist has got 40, 50 minutes with patients, and they could be talking about a lot. Turn them on to injectables, it's all they're talking about. Literally all they're talking about. So then you get into all the other stuff that you build over time with microneedling and PRP and that kind of thing for that. Get before and afters, incentivize your team to refer patients to their office. My team here, they've all got plenty of friends, right? I mean, they've all got plenty of friends. If they refer one of their friends for Botox and fillers, then we give them $100 for each patient that not only, that books an appointment, but actually gets treated. $500 or more, I give them $100 to get their friends into their practice. You want to build your practice? That's great. It is the best $100 you're ever going to spend on your team, so they get incentivized. I mean, this is such a win-win for all of them. So again, the way that we teach and the way that we go ahead and teach dentists also the business side of it, and you'll see, we'll talk about that in a little bit when we get to training. it's hard not to succeed. It really is just going to depend on you, because your team is going to be pushing you like anywhere else. And by the way, we're going to be pushing you to get started, because I will tell you one secret I've learned over 45 years of training dentists in all kinds of things, that as soon as you learn something new, if you don't get started right away, then it'll be 6 months before you do anything. And we're not, in the AAFE, we have a whole team designed just to get you going within 14, not later than 30 days. I mean, if you're resistant, then nothing we can do. So I'll say this, I'm sorry if you're not going to like what I'm going to say right now, but if you're not going to go ahead and do this as soon as you get trained, then don't do it. I mean, I just don't get trained. It's a waste of money, because there are occasionally, we've got a very high rate of success with dentists getting trained and getting into this right away. What really frustrates me personally and the entire AAFE team is, 6 months later, a dentist calls out, yeah, I took the course like 6 months ago. I just remembered it. Your team is dying for this. And you're treating it like the inlay-onlay course or the veneer course you took, 2 years ago. Yeah, I'll get to it eventually for this. No, we're going to show you exactly what to order. It'll be in your office. As soon as you get back from this course, you are going to start making money from real paying patients. That's what we want to do. So we're different than every other training organization, because we want to set you up for success, because you already have most of what you need for this. Secret number 3 is marketing Botox and fillers is not like marketing dentistry. Patients already want these treatments. They know these treatments. Right now, if you've never been trained in Botox and fillers, most of the patients coming in tomorrow to your practice, they know this better than you know it. I mean, they've had Botox and fillers. They know all about it. So once you start offering it, there's not a lot of education for many patients, especially those that have had it already. And again, here's another younger patient that has had thousands of dollars worth of Botox and fillers over time. So most dentists believe marketing is expensive and complicated, but it's not. Your patients already trust you. They're in your chair. You just have to tell them that you're starting to go ahead and offer Botox and fillers, and do a few successful before and afters like this. They're going to refer their friends. The nice thing is, and you always ask for referrals, and this is something, simplest thing that people never do, is ask for referrals from your nice patients that have paid you. But you know what the secret is about the nice patients that have paid you for any part of dentistry, but certainly for Botox and fillers, is that they have friends who are just like them. They want these services, they pay for these services, they don't complain, and they'll refer more people for you. And by the way, the AAFE has got tons of done-for-you marketing materials for that. You're going to add it to ask every hygiene visit, do you know that we offer Botox? If you ever had Botox and fillers before, you're going to start building or use some of the AAFE with the AAFE logo. You become an AAFE member as part of whatever package that you might get. Then you are going to be able to use the AAFE logo for that, AAFE before and afters. That's how you start, but you should definitely make your own before and afters for this too. Let me go to this, because I just want to talk about these young ladies here. Then we're going to show you a lip filler case, and then we're going to go to a trigger point therapy case as well. How did we meet these two young, they happen to be sisters. And this is how it's so changed. And it was mind-blowing to me at the time, again, because I've been doing this for a while. When I first started doing Botox and fillers in my dental practice, who was getting it? 35 years old was considered young. 40s and 50s, that's who was doing it. It was a big secret. That's why they love coming to the dental office, because because they didn't want people to know. They want to see their friends in the dermatology office. But I walked into the office one day, and we have a corridor, and then there's the office, and there's a man there. And I said, can I help you? He says, yeah, I'm looking, for the AAFE Med Spa. And I showed him where it is. I said, but what are you here for? I mean, we treat men, but what are you here for? He said, well, it's almost Valentine's Day, and I know that my daughters, 20 and 21 is what you're looking at. They really want lip fillers. So I came to buy them gift cards so that they can go ahead and come and get lip fillers as their Valentine's Day present. I mean, if we are and this is a few years ago, this is not even today. Now it's so common for young people like this. And I'm thinking to myself, if we are in the era that fathers are buying. Fathers and mothers would say, no, what, are you crazy? You're too young. They're buying it for their kids. Wow, the opportunity is immense. And here you can see their beautiful lip enhancements before and afters for that. Let me show you that. Again, we will come back and answer questions, so you can keep answering questions. Let me show you a quick, just part of a lip filler treatment, just so you get a sense of what it is.
Let's show you a beautiful case of lip volumization here and lip treatment, AAFE level 1 techniques, as you're going to go ahead and see here. And this is, we're just going to show you part of this procedure. It is a little bit longer by a couple of minutes, but let's just show you the highlights here. Using the AAFE safe injection perfection protocols, that's what we are using. And that means that you've got to know the anatomy. You've got to be looking for the arteries and stay away from them. So if you see any kind of pulsing, you want to stay away from that. You want to go ahead and make sure you are giving retrograde injections. You want to make sure you are never giving too much filler at any given time. Now, this patient already has nice lips. We're going to give her fabulous lips. She's got some nice anatomy here. She really needs just some straight volumization, as many patients do, especially patients her age. And patients her age are getting more lip enhancements than ever before. They consider it self-care, just like getting their hair and nails done. So you can go ahead and see there's lidocaine in the dermal filler. She had a little bit of topical anesthetic, Comfortox BLT ahead of time here, but you still may feel a little bit of pinch here and there. But we're being very careful with these injections. We're going a little bit closer to the lip border, not halfway between the lip border and the wet dry line, but a little bit closer to the lip border to give that area volume and kind of turn it out a little bit so it makes it look like these are fuller lips, and they indeed will be fuller lips. They're not super full lips. That's not what she wants. She just wants them a little bit fuller here. Now on the bottom, we are a little bit closer to the vermilion border because we're going to concentrate on turning out her pout. People love to have a gorgeous pout, especially in the middle third. And for her, this is a fairly straightforward lip enhancement with lip volumization, and that's exactly what we want. You can see we are stabilizing the lower lip by flipping it out a little bit so we can see we want to place this exactly where we want it, right near the vermilion border, so it will turn that pout out. People love that extra little pout there, and it doesn't take much on a patient like this, as you can go ahead and see. Now, it's more than just placing it, it is smoothing. This is an AAFE skill. Very few others teach this or talk about this, but this is really crucial. You want to go ahead and smooth that filler, move it to where you want it, not flatten it out, but make sure there are no lumps or bumps. And look how beautiful that looks already on her. And a tiny bit of bleeding here and there, so we're just going to clean that up just a little bit. And now you can see the results of a before and after. There is some Comfortox lips that you can see that is covering the lips, and that is great for aftercare. It reduces any bruising or swelling, and patients can show off their lips right away. That is a beautiful lip enhancement with lip volumization. You can learn to do this too. It is time for you to get AAFE certification trained today.
And you can make big lips, you can make small lips, you can make any lips that you want, really any lips that the patients want, and people are all over the place. So again, that's what we're going to teach you, is how to deliver the kind of lips that you want, just even in our level 1 filler course for that, which is all about lip volumization for that. And there, you really got to think about this. I mean, would a patient rather spend $1,200 on a crown that they don't want, or $600 on a Botox appointment that makes them look great and feel great? Really, the answer is pretty clear. And there's so much else we can do with Botox and fillers. And we're talking about gummy smile cases. I mean, again, I'm not going to spend time on the clinical part of this for right now. I do want to show you one more video, and then we'll talk about, how to train and how to get trained and what's involved in all of that. This patient, look how young she is. She's 20 years old. Do you think that she's got some oral facial pain? What do you think? Do you think that she's got some broken teeth even at her young age for this? Look at the size of those masseters. That is not normal. There's only one thing that can reduce the size of those masseter muscles, and that is going to be Botox. And again, this is a huge part. And I tell every dentist, if you learn Botox just for nothing else, which is ridiculous because you should be doing full face. And again, we'll talk about different states or whatever is coming up, because we've worked with all the state boards on this just about. If you do nothing else as a dentist, it's just treating masseters all day, you can have a very successful Botox practice. But you're not, because we're not going to let you get away with that. There's so much more you can go ahead and treat. And here's an article that I wrote February of 2020, a month before the entire world went insane, right? And for good reason. I mean, because it was a pretty scary time for this. In dental economics, the TMJ nurse will see you now. The point of it then, and this is at this point, over 5 years ago, the point of this article then was, hey, if you're not going to treat patients for TMJ with Botox, then the TMJ nurse will see you now, because every med spa then, certainly med spas today, okay, run by nurses, nurse practitioners, physicians, whoever, but mostly nurses and nurse practitioners and PAs for that, will say, we treat TMJ. What are they doing? They're giving Botox injections into the masseter and temporalis. And the scary part to you should be, it works. Okay, and patients feel better, and they keep going back to the med spa nurse to get what they think is their TMJ treated, because really, when you look at the research, over 85% of oral facial pain, this is the evidence-based, and they teach this in every single oral facial pain residency, over 85% of oral facial pain is muscle-based. Botox treats muscles. That's exactly what it does. And also we do trigger points. So let me show you this for that. So by the way, and TMJ for a dentist, it's been the most frustrating thing to treat in my entire life until Botox came around. And in yours, they're the most frustrating patients. You know, your TMJ comes in, you make them the latest and greatest bruxism appliance. They wear it. They come back every week or every 2 weeks for an adjustment. It makes it worse. It makes it better. I don't want to sleep with it. For that, you're grinding it. You know, they paid $600, $700, $1,000 for it. 3 months later, they're still coming in and you're grinding away, and you can't wait for the patient to either move or die because they're driving you crazy. You'd rather just break the thing and just give them their money back because it's so frustrating. You're treating the wrong thing. This is a whole separate discussion, but let's show you what we teach in our level 1 TMJ oral facial pain course, trigger points. It changes everything. So let me show you a quick video on that, and here we go. By the way, they teach this in every single oral facial pain residency. What we introduced in the AAFE, which has now become pretty standard, is the use of Botox for trigger points. Here's what it looks like.
For this lovely patient here, I am working on her trigger points, which are super thick and meaty inflamed muscles on her because she's on her phone all day long being a social media marketer. So she is constantly crouched over and holds a ton of tension in her back. So I'm trying to really work on getting and isolating the muscle and getting right into that inflamed, aggravated part of the muscle. So I'm doing that for her, and you can see I'm kind of working my way around, making sure I don't go at a 90-degree angle and working that muscle and trying to break it up as much as I possibly can. And you can see she's very comfortable too. It's lidocaine and some toxin. So she's getting numbed as the treatment goes on. And now I'm just working the muscle, trying to get her to relax a little bit. You can see how stiff she is. So I'm just trying to really clean her off and kind of diffuse that toxin around. This patient here is helping me figure out exactly where her pain is in her splenius capitis. So we're going back and forth and kind of talking about when it comes on the worst and where that pain exactly is, because we obviously want to target where it is the most painful and get that exact spot that's causing her all this irritation throughout the day. So I'm trying to work on finding the exact spot and working at it and making sure that I'm going to get all the way in there. And oftentimes when patients have a lot of pain in this area, they're going to feel some relief just from you poking them. It's almost like it's acupuncture for them. So I'm kind of just almost triggering as if it was a trigger point for her, but with the small 31 gauge needle, just to make sure that I don't take a massive thick needle there. And I'm just trying to break it up as much as I can, go right in the spot, administer some toxin and break it up some more where that muscle is. So I'm working on doing that, and I'm excited for her to have results.
I just wanted to show you a little bit so you can appreciate it. And I will tell you this, the trigger points, which they've taught in oral facial pain residencies for 50 years, by the way, you add Botox to the mix and it's a whole different thing. So I just, again, wanted you to get a sense of what you would learn in these things. But marketing injectables is so easy because the demand is so high. Do some social media, that's free. I mean, you've got to just let patients know. AAFE has fantastic posters that you just put up in your office about Botox fillers and TMJ or all facial pain for all of that, because it's hard, it's easy to market in your practice. They're already getting it somewhere else, and that's what it really is about that. So you're going to have patients asking for it. I mean, the massive opportunity is really here that most dentists miss, although there's so many dentists doing it now for that. We talked about integrating this and simple marketing strategies to fill out. So let's now talk about training here. And I'll give you the AAFE offer that's only available to you right here. It's only going to be available to midnight tonight. But right now you have three options in front of you. You can do nothing, stay stuck where you are, and that's okay. You're here obviously for a reason. You could try to figure it on your own, which you're never going to do when it comes to this, because you need real certification training. It's what every dental board requires. And they require it of implants, they require it of Invisalign, they required it for everything. But certainly, again, we've worked with nearly every dental board or been in touch with every dental board, and we all know what they really require here. And again, ask questions for this, and go ahead and leverage. You'll leverage all of our experience in the AAFE to make sure that you are successful. Just like, and I just want to show you a couple of successful dentists. Here, Dr. Bo Westmoreland. He is such a great guy. My problem is I can never remember in my brain. He's from a little town in either Alabama or Louisiana. I think he's in Louisiana for that. But he started with us 10 years ago, took just our level 1 Botox fillers and TMJ, has since taken more. Immediate integration. First year monthly production when it was $85,000. 5 years later, he had built it up to 150, and now he averages over 250. He has a whole TMJ center. Again, he's not in a big town, but he's become almost like this regional center. He loves the TMJ and that. He likes the aesthetics too for that, but he has been pumping this out, and I speak to him, probably a few times a year for that. We like to really keep in touch with everybody, plus our community forums, everything we have in the AAFE. Let me show you some testimonials here too.
My favorite thing with training with the AAFE is the support and the family feel. I feel like I can conquer everything and anything I want with the support here. I believe that the American Academy of Facial Aesthetics has a great education because we always go back to the anatomy. The anatomy is everything. Knowing anatomy is so important. And being a dentist, head and neck anatomy is paramount for us. That's where we work. We inject every day. We numb our patients every day. And so this was kind of just very important to understand that in order to be a good injector.
I've taken many courses in both medical and dental related to aesthetics, and the AAFE's approach is compassionate and safe, and a great way to add things to your practice to make it a much better atmosphere in your office.
Students sign up for AAFE courses, they can expect excellent education. They can expect excellent mentoring afterwards as well. Because taking a class and learning a new skill is very exciting. The hard part is implementing that at your office and your practice. What AAFE offers that I think not many organizations offer is continuous support through forums, through continuing classes that set you on a journey with a success rather than just taking a class and then just forgetting it.
So just to give you a sense, I just wanted to show you that. For that. All right, let's talk about training, and then we'll answer all your questions. A few of you have got questions about insurance and states, and ask any other questions that you want for this. But the real cost to deliver this compared to implant or veneer training, again, we talked about this. And it's a big point for this. To deliver everything else, you've got to buy equipment, you've got to buy training, you're going to be out of your office for a long time, I mean real time for this, but we wanted to do something that completely different because with Botox and fillers, it is an elite level training, and we're going to give you all the resources that you need and all the bonuses that you need. Our program easily could be $10,000 just to get started with everything else, but we didn't want to do that. The AAFE did not want to do that, so they really put together a great offer for that. So you're not going to pay $10,000. Here is what you are going to go ahead and be offered right now, and this is only going to be till midnight tonight. And by the way, you buy this in, lock this in now. First of all, you'll deduct it this year. You can take this next year. You can take it whenever really you want. Obviously, you're not going to take it this year, but now is the perfect time for this because at this point, you're trying to get as many deductions as you can. But this is a 3-course package. So if you're just getting started, level 1 Botox, level 1 fillers, level 1 TMJ oral facial pain, or you've got other choices too, like our live patient gum builder course that we offer as well. And afterwards, after I'm done with this, if you anybody wants to see some short videos on gum builder, I can talk about that because that is exploding right now, but I'll leave that for later. But this package, you can get gum builder, whatever you want. Get any 3 live patient certification courses. If you're already an injector, you can take our level 2, our level 3 courses, and really any of the courses that we offer. But only here, you can go at aafespecial.com. By the way, there are only 20 of these packages available till midnight tonight. So whatever comes first, 20 packages gone or midnight tonight. The total package value over $13,000. You can look all over the AAFE website. You will not see an offer like this with all of these bonuses. Completely all together adds up to over $13,000 worth of value that you are going to pay $4,297. And if you stay a little bit longer, I'm going to throw in one more thing, one more offer that will make it even better for you. But bonus number 1 that comes with this package, again, if you go to the regular AAFE, and call somebody in the AAFE, they're not offering you this package. I mean, this is only available here. First of all, first bonus number 1 is not just the clinical training, but all the information that I got is a tiny example of what is in our AAFE, not med spa for you, but aesthetic practice business on-demand training. Although many AAFE dentists have gone ahead and done med spas as well as they've got empty rooms, they own the building, they've got an empty space, and they've opened up a med spa right across the hall. We'll help you with all of that for that. So bonus number 1 is the AAFE med spa training. That's really worth, I think it's missing a 1, $19.97 on this slide. Bonus number 2 is you're going to get up to $1,250 of injectables to be used at the training course. Again, total between all 3 courses probably up to $1,250. You also can bring 1 team member for each course, and that's going to be worth $1,250. You're going to get access to our exclusive membership, post-course support worth $997, 12 months of AAFE membership, AAFE member office logos, and all those kinds of things. All the office forms that you need. You're not going to have to figure out anything. You're really going to get the total package for all of that, and savings, other savings that get total package value over $13,000. That's a 3-course package, and that fits very nicely if you're just getting started for level 1 Botox, level 1 fillers, level 1 TMJ oral facial pain for that. Now, there's a second package that you want with less, but it's valuable there too. For that, it's a 2-course package. If you just wanted to do level 1 Botox, level 1 fillers, level 1 Botox, level 1 TMJ, really, or whatever you want, level 2, level 3, you can use it any way you want. You will get that, but some of the injectables and team members can be a little less because you're only coming to 2 courses there. So avspecial.com for that. If you're already of an advanced injector, then you may want some of our online certification training. This is only for advanced injectors, by the way. It is not for, it's not getting started. Getting started, you have to have live patient training. So if you're an advanced injector, this might be appealing to you there as well. I put it all in one slide so you can see it. So the Ultimate Injector package, the 3-course package, the 2-course package come with all those benefits. You're saving up to 66%. You're only going to get it here. You're only going to get it till midnight tonight. So if you want it, grab it. And I see some of these are really coming in. That is really going to be. Each one of these courses, by the way, is 10 CE courses for that. So again, 3 live patient certification courses. That's going to be a total of about 30 CME or 30 CE. 2 courses are going to be 20 CE for that. So avspecial.com till midnight tonight. Let me take some training questions. Now I'm going to go to the big package because that really is the best place to start. Those are the dentists, by the way, in our that we talked about in our when we talked about this. Oh, let me get to the special bonus there too. I might as well get to that right now too. When we do our office survey studies, the ones that take the 3 of them, including TMJ or all facial pain, they are averaging, I think it was like averaging somewhere $48,000 a month extra. This is not an expense. This is totally an investment in you. And by the way, deductible, and you want it deductible this year for sure. That really is going to help your taxes because that's a good investment for you. If you just add 2 Botox patients a day, you literally will make back your entire investment in the first month. Truthfully, and we are going to push you to get started within the first 14 days. It literally takes a total of 5 to 6 patients of whatever to make your tuition back. It's $4,297 when the average Botox treatment is $600 to $700. Again, that's 5 patients, 6 patients. You do some fillers, you do a Botox and the filler case together. That's $1,200. You're talking about a very few patients to get your investment back. And the rest of it is your pure profit. Again, it's your fixed costs and that kind of thing too. Where do we give courses? All over. I think the AAFE upped that to 20 packages, so not 12. So I think they wanted to make sure enough people got in, and they are going fairly quickly. The courses are all over the place. Perfect for you thing. We are with the AAFE is in about 10 different cities every single week. And you can see some of the cities, which is all over the United States. The stars are AAFE training centers where we give most of our courses every single month. So you can certainly go to training centers, but we are in all these other locations, at least bi-monthly, most of them. So we are near you, or you can travel to come to a course as well. So that's a very good question. That's really what it comes up for all of that. So let me go ahead and to what Emily just posted in the chat. This is the special offer I'm going to go ahead and give you. Your investment today, only $42.97, AAFEspecial.com. But because you stay till the end, this is a special bonus. If you add 1 more live patient training course for only $700, that's what Emily just went ahead and do this. This is only on the $42.97 package. If you add 1 more course for $700 and make it a $49.97, then you can take 4 courses. That's going to bring your per average course down to $12.49 per individual course. That is the lowest the AAFE has ever done for this. And you get all these bonuses. Nowhere else on the AAFE website are you going to go ahead and get these bonuses. So you are going, that it's really important. Here are the locations again. Locations are all over the United States or someplace near you, or a really good place where you want to go, like Atlanta, Las Vegas, Denver, New York City, Nashville, or Cleveland, because that's our home base and we have a training center there as well. But go to AAFE. The only place you should be going is AAFEspecial.com, and you can see this. Let me show you that offer again. So again, the 3 package offer is $42.97, and you can go ahead and add on $700. Now, you're going to buy the $42.97 now, and then the AAFE is going to reach out tomorrow and give you a one-time offer. Do you want to add on to the $42.97, only this package, another $700, and then take 4 courses? We have weekends now, or we have courses that do Botox, level 1 Botox, level 1 fillers, level 1 TMJ, and level 2 Botox that you can take all together over the course of 2 days. The way these courses work, so let me get this, make sure we get this out of the way, and then again, we're going to go ahead and take questions here. But the way this works is you sign up for one of these packages, AAFE is going to get hold of you, find out exactly which courses you want to go into. They're going to put you into those courses. They're going to make you a one-time offer of $700 to go to $49.97 and get 4 courses, which is an immediate savings of another $1,200 or $1,400 or whatever that number was before. And you'll pick the location. Don't worry about the location. You'll get the location that you want. Again, here are all the locations for all of this, and you will get all of these. The first thing they're going to do is put you into the course. You're going to take all the didactic. You're going to see all the treatment videos. This is going to be all on demand. You need to finish that on-demand training before you come to your live patient locations where you are going to bring a patient, or you'll find a patient at the course. Ideally, bring your own patient or patients and treat them at the course, and then take them home, because then you'll be able to see what actually happened with them. Again, sometimes you're traveling, you can't bring a patient, should bring a team member, and they can certainly be your patient there as well. Ideal, I would say a good portion, over 85 to 90% of the dentists that come bring their own patient, because you're going to see what happens, because Botox takes 2 to 10 days to kick in. Fillers takes a few days to settle in there a little bit too. That's really the best way to go ahead and do that. Again, if you need to find a patient at the course, happens all the time, you can do that as well. But you've got to finish that on-demand training. And then, again, the AAFE will work for you. But as soon as you sign up tomorrow, they will get you started. So you can start training in January. You can start, get your training in January, February, and you will start doing this. And 2026 will be a whole different year for all of you there. I'll go ahead and answer some questions. Again, over 22,000 dentists trained. Again, we work with everybody. We're the most trusted name for injectable training by far, with the most benefits. And these are the people. We have the best faculty in the world by far. There's nobody even close with this faculty. A lot of them are dentists, and some of them are physicians, nurses, nurse practitioners, dental hygienists. We have 2 dental hygienist faculty, because there are about 7 states now where dental hygienists can go ahead and do that. Check with your states. I can answer some questions on some of the states. Make sure you follow the AAFE on all the different channels. I'm going to leave it at this right here. So go to aafespecial.com. Actually, let me go back and go to this one, because that's the big package that most of you are probably going to get it anyway. All right, I'm going to take some questions, so feel free to add questions. But I will tell you that this is going pretty fast. AAFE will probably pop me over a list so I can tell, I can see who signed up and give you a thank you, first names only for that. And then you'll get an idea of how many packages are left, because there are only 20 packages, or by midnight tonight, and they will go pretty quickly there too. Let me just see if they sent something over for it. So congratulations to Abigail and Lee and Grace and Alia and Fernanda and Matthew and Natalie and Lara and Zatika and Michaela and Sharon, and I'll come back I'll come back to more of those. Michael, go ahead and get to aafespecial.com. Go ahead and do that, or reach out right now to register at facialesthetics.org and see if they will. Emily is on from the AAFE, and see if she will go ahead and if somehow you can get to Emily by tonight, at least send her an email, and then she can try to save a spot for you. But the way that they're going, it's not It's no guarantee for all of that. All right, let me answer some questions here. We got a bunch of questions for that. I was warned by my insurance company that if I get caught applying dermal fillers for any reason, they will not renew my policy. That is a very strange warning, Paul. There are most insurance companies cover it. Change insurance companies. Do not let an insurance company hold you back. That is ridiculous. I don't remember the last time I've heard this. So it's really, whatever policy you have is really antiquated, because many dental insurance policies already cover this automatically. Some require a rider. It just depends on where you are for that. That rider can be $500 to $1,000. That's another patient, and that will cover you. So that's not going to hold anybody back for that. You do not need a medical director if you are in New York or any state. If you are a dentist, if you're a dentist, by the way, you can be a medical director for nurses. I mean, I have 3 nurses working for me right underneath my license for that. Which dental malpractice insurance is the best to cover Botox and fillers? A lot of them. Medical Protective has an add-on rider. There are so many dental insurances, it's really hard to give you an answer. Fortress, it just depends what policies you have. And I know Fortress on our AAFE forums, people were talking about Fortress today. I will give you, by the way, we have a great insurance agent that works with many AAFE members, dentists, or really any kind of medical personnel to do that. If malpractice insurance is not even an issue anymore, we can certainly guide you and send you to insurance agents that can get what you need for that. You do not need a medical director to administer Botox and fillers in New York. If you're a dentist, you can actually be a medical director in New York or most states for that. You can do this all underneath your license for that. You recognize one from the picture. She did training in Michigan. That's great. Let's take a look. Let me see. Let me go back a little bit. California, California has got, you have to know how to do this. And by the way, the AAFE teaches many courses in California. We design treatment sheets for dentists all over the United States that you're going to use in the course, that you're going to use that treatment sheet, because that's going to keep you. It's all about documentation and keeping within the scope of dental practice. And we created literally the diagnosis and treatment sheet that is going to make sure that you stay within the scope of practice in California, New York, and Texas, in New Jersey, and every state across the country for that. In California, there's got to be a therapeutic component. 98% of cases that you're going to treat with Botox and fillers has got a therapeutic and an aesthetic portion all at the same time. And you're going to document it just like that in California. And that's what that treatment is for. You'll understand a lot better when you take the course. And so that's it. But we've trained thousands of dentists in California at this point in time since 2010, including members of the state dental board in California when they were sitting dental board members, including the president. I remember training the president of the California State Dental Board many years ago for that. Let's take a look at other questions here. So the courses are all over the United States. I thought you had to have a medical license in order to open a med spa aesthetic practice. Is this not true? That is not true. You can have a dental, everything you open is going to be a dental practice. It can be only geared toward Botox and fillers, and you can call it a med spa, you can call it whatever you want. You're a doctor. Remember, you're a doctor. So you can be a medical director and have nurses working underneath you in most states. Again, this does vary a little bit, but in most states, that's number one. And number two, you can own a med spa in most states, or you can own a dental practice that only does Botox and fillers, and we can help you with literally all of that. Literally can help you with all of that. For this. So liability malpractice insurance is not a problem for that. How to market if your state board is not allowing dentists to do it. I don't know what state you're in, but every state board allows dentists to do this within the scope of practice. Yeah, you have to understand, face, head, and neck are all within the dental scope of practice by the definition of dentistry in nearly every state. In every state. I mean, we do this again. We give courses with the American Dental Association. You can't get more dental than the American Dental Association. We give it at their annual meeting. We give a couple at their headquarters, but we've been working with the American Dental Association for many, many years for now. So congratulations. Let me just tell you who else has signed up here. I don't remember where I left off, but Grace, Kaushel, Hyanun, Brian, Thomas, Judley, congratulations to all of yours. Judley, I think you need a little bit of help for that. Can you apply this if you do mostly temp jobs? There are a lot of med spas, salons, a lot of places that are looking for a dentist or someone to inject Botox. Just remember one thing, this is going to be important. When you inject Botox, no matter where it is, you have the same standard of practice that you do in your office. It's almost like you're renting a little space and that's your dental office. Because what do you need to inject Botox and fillers? You need a room, you need a chair, you need some syringes and gauze and gloves and the Botox and the fillers and really and standard of care, how to treat all these things with sterile technique, all things we're going to learn. That's it. That's what you need. It's great for temporary jobs, or even if you rent out, an office or a room at just about any place to go ahead and do this. But we can answer all the state dental board questions. That is not a problem. The AAFE team is trained to answer all of those questions there. Let me see. We got a bunch of new questions that have popped up. So let's go this. The vials come in 50 or 100 units. So yeah, don't worry about that. But again, you are going to get, when you come to training with these packages, you are going to get a vial or a filler, whatever it is that. State of New Jersey, we've been teaching there. We are actually the first board approved course in New Jersey, and it's not perioral only. They treat face, head, and neck, all within the scope of dental practice, all with proper documentation that we do. We are the first board-approved course in New Jersey. We have trained the most dentists in New Jersey, more than anybody else who are doing face, head, and neck. And again, it's about documentation. We are going to help you with all of that. Again, you're going to get injectables as part of this package, so that is very special for this. And state of Florida, for sure, you can inject Botox and fillers just for cosmetics. Can you do cosmetic dentistry in most states? Just for cosmetics? Can you grind down teeth and put veneers on just for aesthetics? Yes, and these are good, healthy teeth, right? You shouldn't, but you can for this. State of Florida, you can do it just for cosmetics without issue. We're in state of Florida all of the time for that. God bless you and happy holidays to you, Francisco. Nice of you to say that. New Jersey, again, we've been working with so many of these states for this. You can do fillers in Virginia for therapeutic uses. And again, 98% of fillers have therapeutic uses there as well and have to be documented, but we teach in Virginia all of the time. So certainly you can do Botox in Virginia for that. For someone starting out, you recommend the 3 certification courses or 4 courses. Whatever you want to start getting into, now's the time. Remember, you're going to get a good tax deduction. I would definitely do the upload to add on that 4th course for another $700 when that course is usually $19.97 is a bargain, and you can use it all at the same time, or you can use it another time as well. Let's take a look what else you are asking. How many patients do you request or each day? Bring at least 1 patient to the course. Many times you can find the second patient in the course. I want you to at least bring 1 patient to the course that is going to go home with you so you can see what happens. That's the best learning experience. Do you have to do that? No. Could you find a patient at the course? For sure. What usually happens is then everyone starts treating each other because, they're into it and they will also, all of you want to look good and feel good. You want to see what this goes ahead and feels like. Absolutely. you'll be treating patients at the course. But ideally, best learning experience, bring your own. And again, that's your free team member, or whoever you want to bring. Your free team member, by the way, somebody asked it somewhere. Free team member cannot be another dentist. It's got to be a non-injector. It's got to be a dental assistant. It's got to be an office manager. It's got to be husband, wife, not kids. I wouldn't say kids for that. Okay, for this, can you get this? You're part of a DSO, need to confirm this expense. Can I get this deal after I confirm with them tomorrow? You can get it tonight. So, you know, that's all I know is you can get it tonight, till midnight tonight, for that. We work with a lot of DSOs, or a lot of DSOs know us. We've never had a dentist that's been bumped by the DSO for that. Again, you've got a hand in this too. A lot of DSOs, we train a lot of DSO dentists all the time. We've never seen it where they've said, no, you can't go ahead and do this. These are the most popular procedures in the world and the most profitable from an ROI standpoint. So DSOs, I think, are all about productivity and profitability for that. Can you do Botox and fillers only in the med spa in Maryland, Virginia, and DC, and own a med spa? So I don't know exactly about owning a med spa in those 3 states. Maryland, probably. Virginia, and DC, I am not sure for all of that. But any place you practice is a dental office. Remember, your license is a dental license. Even if it's just a room, that becomes your dental office for that. And you can practice dentistry, which is Botox and fillers for all of that. Yes, fillers, there are lots of therapeutic reasons for fillers for that. That was that whole list I put up earlier in this presentation for that. Where can we find the form where we mark if the Botox is therapeutic and or cosmetics? You will get that as part of the course. That's going to be a treatment sheet that you will use at the course. That's an AAFE exclusive. You're only going to get it at AAFE courses, and you should be using that treatment sheet, which you can digitize too. You should be using that treatment sheet for treating every single patient for that. Let's take a look. For that. When I looked it up, it said dentists not allowed to be a medical director for a med spa. Oversee PAs and nurses, need to find an MD. I don't know where you looked. I mean, with dentists around the country, AAFE dentists are medical directors. But remember, the nurse is working underneath you is going to be limited to your license. So he or she can only do face, head, and neck treatments for that. If you want a full-blown med spa, which a lot of dentists want to do, they also bring in a medical director or physician, because then that extends them to do full body treatments and that kind of stuff. So it really depends on what you want. Don't worry about the med spa piece right now. By the way, as part of this package, you're going to get the med spa aesthetic practice training, and that is going to go through all this with you, and we'll go through all this with you, because we have so many dentists on the AAFE community forums, which you're going to be a part of. We're all there to help you for sure. Fillers in the face can be therapeutic, absolutely. It's all about lip lines. It's all about smile lines. It's all about phonetics. It's all about a lot of different things for all of that. How long is the training? Each training is 10 hours long, 6 hours on demand, 4 hours live patient. The live patient is incredibly intensive, where you're going to treat your patient, and you're going to see a lot of patients being treated and really going through. So Emily, if you can help Judley, who's having trouble with getting a payment processing. So you can, Emily, if you're on, you can give me your email and he can reach out to you. Or I'll put it in, because I'm not sure. I don't know where Emily is. So let me put this on, facialaesthetics.org. Again, I don't know if she's going to be around to help you tonight, but if you do email Emily, then Emily, you beat me to it. All right. She can help you. She can definitely help you if you're having trouble with that. And a couple of others you may be having it too. Sorry, you're a faster typist than I am for that. Let's see. So how long is the training? So a typical one, let's say you are going to go to level 1 Botox fillers and TMJ. That is a day and a half, but you're going to do all the on-demand in advance. Then you're going to come The first morning, it could be Thursday, Friday morning. That depends on the location and the dates for that. But let's go with Thursday, Friday. Thursday morning is going to be Botox live patient, but you've already completed the on-demand. Thursday afternoon is going to be fillers live patient. You've already completed the on-demand. And then Friday morning is going to be TMJ, oral facial pain. You've already completed the on-demand. So when you come for training, this really minimizes the out of office time. And that's really important there too, because your time is money as well, right? So that's really important that you make the best use of that time. I'm also going to tell you this, and those of you who have signed up already, we can't wait to work with you. Those of you who haven't signed up yet, but you're still thinking about it, if you're still thinking about it, you're not going to see this offer ever again. So now's the time to really jump in and do this. But please finish your on-demand training before. Have the best experience. Really go through it. It's didactic. It's treatment videos. You will be so well prepared for the live patient. Don't leave it for the last minute. We know that the most successful dentists that come through our courses are going to go ahead and plainly, what are they going to go ahead and do? They are going to really learn the on-demand, look all the treatment videos, and be ready for that live patient rather than the day before they're trying to cram it all in. You can do that, and sometimes it just happens like that. But really learn this, because you're going to have this literally for the rest of your career there. So that is, that's all of that. All right, let's go ahead and see any other questions that we had for this. Yeah, you will get three, Francisco, you will get 3 different certificates. You're going to get a 10-hour CE certificate for level 1 Botox, 10-hour CE for level 1 fillers, 10-hour CE for level 1 TMJ oral facial pain. Again, add on that 4th course, and then that 4th course can be, and depending on the location, the 4th course in 2 days. You're going to end up taking 4 courses, and the 4th course just for another $700. AAFE is going to give you one offer tomorrow when they contact you, and that 4th course is going to be either gum builder or it's going to be you can do level 2 Botox, all in the same 2 days for that. You'll complete all of that. That's 40 CE over 2 days. But my golly, you can deduct it now. Now is like the perfect time to do this and start taking this in January, and you will be up and running by February 1st. You will be up and running and treating patients for that. Okay, I think I've answered that. Let me see. That really should help you quite a bit. Let me see. And I'm sorry if I missed any names for this. I know Natasha's trying to get in there too. So I'm sure Emily can help you for that. How do you advertise for your office if you don't do dentistry and only do injectables without creating confusion? That's not a problem for that. Social media, show before and after, show the before and afters that really show the before and afters that include smiling patients. And that's really your best. I mean, social media is free. That's a great way to go ahead and do that. We have many dentists that only do injectables. You know what many dentists do? They have an existing office already. Botox and fillers is so much easier than trying to do an endo and a crown on an upper second molar. They are, they'll hire an assistant. They get busy enough with Botox and fillers. They hire an associate to do, the restorative work and all the other work because they're having a lot of fun doing that. PAs are going to pay the same price there, Grace. So get in on it now. It's a tremendous offer for that. And again, you can pick advanced courses. You can pick whatever courses that you want for that. But we never had confusion. There are a lot of dentists that are only doing Botox and fillers, maybe a little bit of dentistry, or they're doing some whitening there too. That's the beauty of dentistry, is you really can do whatever you want. I mean, you really can go ahead and do whatever you want when it comes to that. If you like ortho, you'll do a lot of Invisalign and maybe nothing else. If you don't like doing restorative or implants or crowns, you can pick a lot of other things in dentistry. Certainly, this is what you can really pick for that. I mean, it's really, really great for that. All right, I think we are just about ready. I'm here to answer more questions if you haven't. If I haven't answered your question, put it in again, and we'll see if we can get to it. For that, I'm just scrolling back, and I think we've gotten so many of these questions answered. Let's take a look. Okay, so again, you can rent any space you want, but that space that you rent, even if it's a small little office, because you need a chair, you need a light, you need some cabinets for that. That's your dental office. The dental offices do not have to be 1,000 square feet. They can be exactly 100 square feet, and that any place you practice is your dental office. It's just that everything you're doing is dentistry. Everything you're treating is within the scope of dental practice. So you are treating dentistry for that. What happens if there is migration of the fillers? Well, first of all, with great technique, you are not going to get migration with fillers, but if there is migration of fillers, you can dissolve fillers. That's the nice thing about it. We are working with states. Janelle, what state are you in? Because we are working with there are a number of states, Oklahoma and Kansas and Arizona and Utah just passed. They're just waiting for the requirements that we're helping Utah with. New Mexico, I think, is on the list for one of these days to do it, but again, it's going to spread. I mean, now Colorado dental hygienists can go ahead and do this. Again, I don't have them all off the top of my head, but we're working with Kentucky. We're working with a lot of these places for this. Do we need to renew the license of these courses after certain periods? There are some states that require you to then, take another, but it doesn't have to be the exact same Botox course. You can take an advanced level Botox course or even online certification. Arizona just passed. I'm pretty sure it's Arizona just passed where you've got to take an updated course every 3 years within every 3-year periods for that. But most states right now do not have that requirement. But I'll tell you this, what's going to happen is you are going to get started. You're really going to love it. Before too long, you're going to come. After you treat a few patients, you say, this is great. Patients love it. I want to learn more about this. It's a curriculum. There's level 1, there's level 2, where you're going to build on your foundational skills, and that with advanced procedures, offer more to your patients. You're going to see your treatment plans are going to go up, and patients are going to pay more because they really see the results. Then you're going to come back for a level 3. We see this progression all the time. It's a real curriculum here. But level 1 will give you 80% of the most common procedures that you're going to get started within the first 14, not more than 30 days. We're not going to leave you alone, to really get started to go ahead and do this. All right. So that is that. Sure. It's my pleasure. I gotta tell you, we are here to help you. We have 80 faculty members. We have 10 full-time faculty members. We've got an entire AAFE team that is here to do one thing, and that is help you get started and help you be successful, not just get started. We have our community forums. There is no one else that has the support that the AAFE has for that. All right, let's see. Any other questions that we can help you with? And again, if you had trouble getting in for whatever reason, it's not going through, immediately email Emily at facialesthetics.org, and you can go up a little bit and see her email. So if you did have trouble getting in, she will help you and make sure that you get this. So Emily at facialesthetics.org. Emily, if you want to put that in again for whoever. But there are only a few of these packages left. So if you want them, you better go ahead and get them. So congratulations to Matthew and Natalie and Lara that have come in. I may have not said her name. Michaela, another Sharon there. So if you want it, you better grab it. Thank you, Emily, for putting that in. If you're having any trouble, then Emily at Facial Aesthetics, if you don't send her anything, then you are not getting in. Then she will try to do her best to get you in and save a couple of spots for all of that. But I think that's really about it, folks. We really do appreciate you being on with us. Again, there's your final for that. And I'll just tell you one more thing, Paul. Great to see you. Thank you to all of you. Those of you who signed up, again, we cannot wait till you got the deal of the century. I will tell you that. And we can't wait to work with you. Those of you, which is 99% of you that took the $42.97 package, again, they'll reach out to you tomorrow. One-time offer. Extra $700 to get to 4 courses. Again, they'll work with you, tell you what's available, and see if that's the best option for you. But that's an added savings for being on. Thank you to all of you for being on. We went a long time. You had a lot of questions. We were happy of this. I hope this was good for you and the training was good for all of you. But there's my email. There's AAFE's email. There is a whole bunch of websites you can go to. Thank you for being on. Emily, thank you so much for hanging out with us and helping these nice people being on. Can't wait to work with you, new AAFE members and existing AAFE members. Great to see all of you and not yet AAFE members. Happy holidays to all of you as well. Take care, everybody. We will talk to you all again real soon. If you ever need anything, reach out to Emily, reach out to me. We are happy to help you any way we can. So take care.